Hi, Dr. Gallagher and Dr. Frederick. This is Group 10. We consist of Mackenzie Allison, Abriel Brandon, Kayla Medina, Marie Alyssa Nicole Savar, Jennifer Than, and Madison Whitehead. Our clinical question is, among patients in the labor and delivery unit in the first stage of labor, do birth ball exercises as an adjunct to pain medication compared to pain medication decrease labor pain? This is our PCOT format. So, why do we want to study birth ball usage and its effect on labor pain? We want to study this because current medical care for laboring mothers relies primarily on pharmacological interventions. These pharmacological interventions come with many risks and play a significant role in the United States having one of the highest maternal mortality rates among developed countries. Birth ball usage, on the other hand, has no observed side effects and there are many suggested benefits. The purpose of this study was to evaluate the effectiveness of non-pharmacological interventions, such as birth ball usage, also known as a Swiss ball, massage, and warm showers to relieve labor pain, shorten labor, and delay pharmacological analgesia use. The rationale the author provided for executing this study was that the strong and persistent pain associated with labor may negatively affect both the mother and the fetus. And while there is current scientific evidence that supports the use of non-pharmacological interventions to relieve labor pain, no study to date have examined the sequential or combined use of these interventions, which may yield better results. This study is a randomized controlled trial. A convenient sample strategy was used to obtain a total of 80 participants. The inclusion criteria for our sample was women primigravida greater than 37 weeks with spontaneous onset of labor for a single fetus in cephalic position, low risk, cervical dilation of 4 to 5 centimeters with appropriate contractions for this phase, intact ovular membranes, and literacy to understand the study. This was a hospital study setting that took place in Brazil in a 40-bed maternity unit over the period of October 2011 to July 2012. Our independent variables were non-pharmacological interventions including utilizing an exercise ball, lumbosacral massage, and a warm shower. Our dependent variable was degree of pain severity. The independent variables were operationalized inpatient with the implementation of each intervention for a duration of 40 minutes at different stages of labor. The interventions included utilizing an exercise ball at 4 to 5 centimeters dilation, lumbosacral massage at 5 to 6 centimeters, and a warm shower at greater than or equal to 7 centimeters dilation. The dependent variable was operationalized by looking at pain reportings, birth records, and questionnaires. The instruments used to measure the dependent variable consisted of the visual analog scale to measure pain severity. The analog scale was valid in that it measured the patient's pain and reliable in that they used the same tool to measure every patient's pain. The Research Ethics Committee of the Faculty of Medicine at Ribeirão Preto approved this study, and all participants gave written informed consent. The descriptive statistics used in this study were means and standard deviation of patient severity at each assessment time and outcome, and pain severity after each of the 3 interventions for both the control group and the experimental group. The inferential statistic used was confidence interval. The mean change from baseline was then compared between groups and reported with a 95% confidence interval. One of the limitations to this study was the use of vertical positioning in all phases, as this may have impacted labor pain. Another limitation to this study was the presence of a therapist, as this provided the women with support, much like the presence of a companion would, which may also impact labor pain. This study had many strengths, including that it was randomized and the assessor blinded. Moreover, the sample size calculation used a higher study power than is often used in clinical trials, and the non-pharmacological interventions that were used significantly reduced labor pain. The study showed that the sequence of non-pharmacological interventions used did significantly reduce or delay pain severity and the medication use from 4 centimeters to 7 centimeters of dilation. In this study, on average, women in the control group asked for analgesia by 6 centimeters dilation, while women in the intervention group did so at 8 centimeters. Furthermore, the control group also required extra dosing of analgesia significantly more frequently than the intervention group did. The article that we selected answers our clinical question in that the use of non-pharmacological interventions, such as an exercise on a Swiss ball during the first stage of labor, significantly reduces labor pain. In the outcome section, it stated that exercise on a Swiss ball reduced pain severity by more than 13 millimeters on the visual analog scale, and that the request of pain medication was significantly later on the experimental group. However, a lumbosacral massage and warm shower were also done sequentially after exercising on the Swiss ball. It is possible that these findings could be applicable to the patients in the U.S. However, there needs to be another research study done in the United States which will ensure that it would be applicable to our healthcare system. Our research question would be better answered by a study that used only the exercises on the Swiss ball rather than adding a sacral massage and shower therapy. This would allow us to determine that any effects in decreased pain would be attributed to the use of the Swiss ball. An optimal setting for such a research study would be at a hospital in the United States using women in the first stage of labor with uncomplicated pregnancies, with the independent variable being the use of Swiss ball exercises and the dependent variable being pain severity. That concludes our research article presentation. Thank you for listening.